Hello, I am Dr. Archana. I am a consultant nephrologist working at Sunshine Hospitals Gachibowli. In this video, I am going to tell you about the kidney diseases. There are many types of kidney diseases, but CKD is one of the most common and important disease of the kidney. CKD stands for chronic kidney disease. Chronic kidney disease is diagnosed. Kidney function abnormality persists for more than 3 months. So, what are the ways we can know whether the patient has CKD or not? There are ways to know that. The tests which are done to know whether the person is suffering from CKD or not. As we all know that kidney function so well that even their 50% function is lost, we will not come to know unless we do the test of the blood or urine. So, GFR is another entity, that is the glomerular filtration rate is the modality by which we know the percentage of the kidney function. So, this GFR can be calculated by using the blood. Depending on the number of this GFR and the degree of this protein leakage in the urine, the chronic kidney disease is graded from stage 1 to stage 5. Depending on the GFR rate, as the GFR goes down, the kidney disease progresses to the last stage. Glomerular filtration rate, that is GFR, is around 90 to 120 ml per minute. When it goes below that, it is taken as a CKD. The patient, if has single kidney or some abnormal placement of the kidneys, that is also taken as a CKD. Now we see some of the important causes of CKD. CKD can happen in any person who is suffering from diabetes, hypertension. Third thing is the patients having family history of kidney diseases or patients who are using painkillers over a long period of time, patients having kidney stones, and patients having glomerulonephritis. Glomerulonephritis is the inflammation of the kidney which can affect at all ages, right from children till old age. And there are different types of glomerulonephritis and different presentations of glomerulonephritis. To detect CKD early, CKD can be detected early only with the help of blood and urine test, as I mentioned before. Without doing tests, it is very difficult to diagnose the kidney disease at early stages. Early detection is most important as we can prevent the further complications of the kidney disease. So, let us be aware of our kidney status or any of our family members are at high risk of the kidney disease. Thank you.